Hey, it's your boy Richard Fowler. And on this episode of Talking Together, we explore what's happening in mid-sized cities all across the United States. To do that, we are being joined by Levar Stoney, the mayor of Richmond, Virginia, to find out how they are flattening the curves in their cities and what's next as we tackle the coronavirus together. And we're back on Talking Together. We're joined by one of my really good friends. It's good to have good friends in high places. Um, Ladies and gentlemen, the mayor of Richmond, Virginia, Levar Stoney. Welcome to Talking Together, my brother. How are you?
I'm well, Richard. How you doing, brother?
I am good. Well, there's just so much to talk about and so much to unpack. But let's first start with this. Virginia, like a lot of the other states, are dealing with the coronavirus. The Virginia outbreak hasn't been as large as, its neighbor to the north, Maryland, or further north, New York, or even places like Georgia. So there has been some level of flattening the curve in Virginia overall. Part of that is some of the work that you're doing in Richmond, Virginia, one of the larger cities in the state. How are you guys beating the odds or beating the statistics?
Well, we've been in some sort of level of quarantine for the last over 6 weeks. And so I'd like to think that we're one of the early adopters. We closed down large gatherings early, and we've been in the stay-at-home order for a number of weeks now. And in Richmond, we've only had about over 300 positive cases. We've had 14 deaths. Those obviously, in just one case is a lot for me, right? Because I think every day, every person would want to be back doing what they normally do pre-COVID-19. But we've adapted, we've adjusted, and right now schools are closed, all of the businesses are closed, and so for the most part, people are social distancing. They're adhering to the guidelines that the CDC has provided, but obviously, I tell folks we still are not out of the woods. There's been some uptick in movements. We are not immune to that as a city. It's a beautiful day out. It's 80 degrees and sunny, so folks are still moving out and about. And what I see is that people are watching, CNN or MSNBC, and they're seeing Georgia and Texas and other states start to reopen, and it gives them the sort of motivation to go back out there and start continuing their regular lives. And I always want to tell folks that this is the state of new normalcy right here. Like there's no going back to what we looked like in pre-COVID times. It's going to take a long time before we get to that. And in order to reduce the period of time that we're in this new state of normal, we gotta lean into social distancing and staying at home. I told someone the other day, Richard, that we've all, me and you, others, we've all been involved in team projects, team exercises in the past. And you know about these team projects, someone is always doing a lot of the work and somebody doesn't even show up and still gets the A, right? Well, this is the biggest team project I've ever been a part of. And for the most part, I think everybody is doing their part, staying at home, and I think we're safer and stronger at home. There's some folks out there who are rogue actors, but for the most part, people are doing their part. But my request to Richmonders and everyone out there is you got to lean in even further.
Well, I think there's so many things you said that I want to unpack. Well, let's first start with this. So the first thing you said there is that you guys are, it's not as big as it could be. And in the Washington Post, or I want to say you said it was like shadow boxing, like you're boxing, but you're not really sure. The enemy's in the ring. You're not sure where the enemy is. When you say that number, is that number the number? Do you think that number could be larger because there are folks that aren't getting tested, or there are not enough supplies for testing, or you think we're doing the best we can with testing and this is what our actual number is?
No, I've always believed that the number is larger than what we've been getting back from the Richmond, from the health district, from the Virginia Department of Health. Why? Because we've seen that Virginia has lagged behind other states in testing per capita, and the only tool we have to fight this enemy is testing. It's the only way we unmask and unshield this enemy that's in the ring with us, right? Otherwise, it remains invisible. And so I've been calling for weeks now for more robust and extensive amounts of testing within the city limits. We've begun doing that. recently the health district started testing in some of our under-resourced and uninsured areas of the city. So basically we're saying to our folks that being uninsured or being under-resourced should not be a barrier for you to receive a test. And so we were in South Richmond last week. We're going to be in all 6 of the large public housing communities as well. And last week in one of our low-income communities, we saw 17% of those who showed up to get tested positive.
Which is almost 20% of that community, the folks who showed up. And so that leads to a larger thing. I mean, you're a mayor that I like to talk about, who's been credited for innovation. You were the one who figured out, like, nobody could figure out how to fix the schools or to fix the municipalities, and you're like, we're going to figure out how to do this. And I love that about you. And speaking to that, like, why was there sort of this inclination to say, listen, we've got to test in public housing communities. We've got to sort of bring the test to the people, which is innovation at its finest, because you don't really see that happening in other places. Yeah, they're testing. Yes, we've seen them do some, but really targeting African American, Latino, Latina, and vulnerable families.
I think we started seeing the trend lines in other places like Michigan, Louisiana, and you saw in Illinois, you saw a disproportionate amount of those who were who tested positive and those who were dying were Black and brown people. And us being the South, us being, you know, a city that has undergone the good, the bad, and ugly of in history, we knew that we had to, you know, jump on top of this early. And right now, I mean, we have had 14 deaths. 13 of the 14 have been African American. And when you think about the continuity of society, like, you know, how we're still living our daily lives, the number of frontline workers, whether they're in grocery stores or they're still showing up at some of their municipal municipal jobs, these are Black and brown people.
And I think that's also the story. I mean, as you know, my mom's a registered nurse, right? She's retired now, but our nurses, our healthcare professionals, our store clerks, these are the folks, our environmental services at hospitals and at restaurants and at the restaurants that are delivering, obviously, right? And grocery stores are people of color. And so this disease, this sort of silent enemy, has wreaked havoc on our community. Yes. And, you know, how do we work on getting around that, right? Because I think as we try to flatten the curve, we also think about the African American curve and the Latino
Yes.
Latina curve has a higher slope than this curve.
Yeah, and here's the thing. I think, you know, when the numbers started coming back and we started seeing that African Americans were disproportionately impacted, there was a disparity between them and their white counterparts. Folks said, well, to be an African American, being Latino, does that mean you're automatically going to get COVID-19? No, it does not mean that. However, if you were to contract the disease, the likelihood of death may be higher, because we've known for generations now that Black and brown people have a disproportionate amount of underlying medical conditions compared to their white counterparts. And in Richmond, it is no different. No different. So if you have respiratory illness, if you have asthma, if you have diabetes or heart disease, that you are in this category of individuals that could potentially die if you contract COVID-19. And so I was grateful that the health director here, Dr. Danny Avula, agreed that we need to step up and where we can be targeted about our approach in getting more Black and brown people tested. And I got to say, Richard, and you've seen it as well. I've seen it even on social media. The number of people who've said, don't go get tested. I mean, the myths that are out there of folks who say that, well, they're going to take your DNA. I don't let them inject me. Girl, all you need to do is go ahead and, like, you know, drink some orange juice and some lime and some ginger and you're going to be all right. Yeah, it's going to help you with your immune system maybe, but it will not protect you from contracting COVID-19. And so I've been begging people in my city to get tested. If you feel some type of way, if you have symptoms, chills, fever, any of those things, you need to show up and get tested. Why? Not only will you may save your life, but you may save the life of a loved one as well, because after you get tested, we'll do everything we can to isolate you and those you've been in contact with, but also get you the care necessary so you can survive this.
Well, and I think that's an interesting point that you bring up, Levar, because I think all across the country, especially in communities of color, especially Black folk, right, there is this sort of air of mistrust when it comes to healthcare. I mean, I'll give you an empirical example. My mom is a registered nurse, worked in the hospital her entire career, and even she sort of gives the healthcare community a side edge, like, well, you know, some of it, and I think that sort of speaks to it, whether it's the Tuskegee Project, where they basically infected African Americans with syphilis.
Yep.
And so there is this fear amongst people of color when it comes to interacting with public health. And I think this fear has manifested itself in various different ways. It's manifested itself in the fact that our communities have higher obesity rates, higher rates of diabetes. We're the last, especially amongst men, brothers. We're the last one to go to the doctor. We will wait until, you know, our foot hurts. Now the foot looks like the size of our ankle, and then, okay, we should go to the doctor, right? So there is a real stigma and a real sort of disdain in communities of color when it comes to healthcare that I think is sort of, we're seeing it now exacerbated in this particular crisis. How do we work around that?
And Richard, I want to just say that, you know, I understand the lack of trust, right? The mistrust in the healthcare institutions out there because of the Tuskegee experiment, because of Henrietta Lacks. You know, I just recently celebrated, you know, Black Maternal Health Week, right? And we've seen what has happened to Black mothers in this country since the time of slavery as well. And now within the healthcare system on how they get cared for, right? And so it's so complex, yet I have to be one of those straight shooters in this situation. I think that's what we lack right now, Richard, is that even at the top, in the federal government, with our leader right now and President Trump, there's a full loss of trust in government in general, right? You can't trust the words that are coming out of the leader of the free world's mouth, right? He's telling folks to inject Clorox or get IV. You can't trust that.
I laughed to stop myself from crying, but yes.
That's right, man. I mean, you have, and that unfortunately, people paint a broad brush with that. So at every level of government, everyone's like, well, why should I trust the mayor when he says I should go get tested? But let me tell you why. There is no amount of castor oil or sunlight or ginger or lemon juice, you name it, that's going to stop you from getting COVID-19. No amount. There is no vaccine and there is no therapy for this disease. So all we have is the testing, the contact tracing, and getting you isolated and getting you cared for in that way to protect you and your family. And we know the statistics say that there's some serious wreckage going on within the Black community and this disease.
And I want to get back to the Black community, but you brought up something I think is worth talking about, and because you were sort of at the front lines of this, right? So what we saw a couple weeks ago from the President of the United States was one of his Twitter storms was, you know, liberate Minnesota, liberate Virginia. Now, Richmond is the capital of Virginia, and you guys have sort of been the host to these, I don't even know a word for them, but these crazy folks protesting. How are you dealing with that? Because I mean, what we're seeing is that this is actually spreading the coronavirus, but it's also it's slowing, like you have to then dispatch your first responders to deal with people protesting instead of going into communities of color and helping them fight the coronavirus.
You know, all we've done as a government is we always said is that we think you need to close down your businesses, stop large gatherings, and stay at home, right? To protect yourself, your family, and other people, the larger public, the community, from the spread of this disease. And you would have thought that we were locking people up, right? There's no other country in this world right now that is going around doing these sort of protesting and flying in the face of these sort of orders because they understand that we are all in this together, right? You know, I don't want to be home. I want things to reopen. I want to get back to my life prior to COVID-19. But guess what? I know I have a role to play in the larger scheme in terms of protecting the public health. I know if I stay home and stay out of the face of individuals, that they're going to stay safe and I'm going to stay safe too. That's all we're asking you. No one is trying to be punitive. No one's trying to be punitive. I want this economy to boom like we're booming before COVID-19. But guess what? This is a crisis, right? And during a crisis like this, we all have to step up. We can't just expect leaders like the president, the governor, the mayor to just step up. We need to individually step up too. And that's why I've always said, Richard, there's no better time to display the humanity and also for us to display the best versions of ourselves right now. And going out there and honking your horn and trying to have picnics on Capitol Square, to me, that's not showing the best version of yourself. You might be practicing your First Amendment rights, but that's not showing the best version of Virginia right now, I think.
And speaking about that, because since while we're on the president, let's tackle all that at once, right? Are you getting because what you hear from the White House, and I think this is the reason why we're talking to mayors of cities, right? And not New York, not Chicago, but medium-sized cities, capital cities like Richmond, is because there seems to be a little bit of, there needs to be some disconnect, right, in communications. I think you talked about at the top of this interview, you're hearing some governors open and people thus think that Richmond is open, or you hear this and you hear that. The mixed messaging that you're hearing from the White House, they're saying that there's so much testing supplies, they have enough ventilators, look at all the work that we're doing. Is that really, are you seeing the impact of what they're saying that they're doing in Richmond, or this is just lip service?
The latter. First, we should not be patting ourselves on the back for doing our jobs, right? It is the federal government's jobs to fill in the gaps that states can't do, what states can't do. That means providing ventilators, providing more testing. I mean, they have to be solution oriented, and instead of just throwing up their hands and saying, well, you know what, that's all we can do. We'll be the last resort for supplies. No, you need to be on the front lines, just like those healthcare workers, just like those grocery store workers, just like the bus drivers. Instead, they're taking a back seat in this. And while taking a back seat, people are dying. People are dying. And so I think we all should expect more from our government, particularly in a time of crisis. And I have, just like many out there, and the opinion research shows it, I expected more, and we are not getting our taxpayer dollars worth out of the federal government right now.
Well, I know it was a total diatribe but I want to get back to the main parts of the interview, but I had to get that out, right? Because
don't get me started now.
That's what I was trying to avoid it. I was trying to avoid it because real talk, I think that there is this, like when I saw the protest, I'm like, how is this really helping? How is the president helping move us forward when he's telling his folks to go out there and he's egging on protests, which sap resources from cities, which you have to send your cops and paramedics and everybody over there, and then helping the folks. So let's get back to what you guys are actually doing. You guys are doing it very well. So I want to dig deeper into how you guys are delivering tests. So a couple of days ago, you guys started to sort of open up testing sites, walk-up sites in plazas that were adjacent to housing projects. You went into African-American neighborhoods. The governor was with you. The president of your city council was with you. You guys are really targeting people of color. The headlines say, like you said at the top of this interview, 93% of those that have died from COVID-19 in Richmond are African-American. It's hitting our community the hardest. What is next? How do you plan to flatten this curve? I know that you can't really, so this is basically the governor of Virginia and the mayor of Richmond have to figure out a plan on how we flatten the curve in Richmond, because we can't depend on the feds to do it. How are you doing it?
Folks will always want to talk about the recovery, the rebound and whatnot. I think let's take the first crisis at hand right now is the health crisis. And that means I continue to beg for more robust testing, more extensive testing. We need to do the diagnostic testing right now. So we need to find out how many positives we have so we know where the disease is, right? And so when folks talk about rushing back to reopen, no. no reopening until we do more testing. Once the evidence presents itself as we've seen a drop in hospitalizations, a drop in positive cases in the city and the state, I think we should start having that conversation. Not saying that we shouldn't be focused on the regulations and the process for anyone to reopen, right? But in terms of any industry, you're a barber shop or a salon, we got to know how that looks moving forward, right? So they should be doing that work, but the focus needs to be, the emphasis must be on testing.
And what's the inherent barrier here, right? Because you're talking about testing, you guys are pushing for testing, but Virginia does lag behind Maryland, does lag behind the District of Columbia when it comes to testing. What is the inherent barrier that is stopping the ability to do as much test as you need?
Here's the barrier. Yes, we have the capacity, volunteers and healthcare workers ready to go to administer the testing protocols. However, we don't have the ingredients for the testing. Either we lack the swab, the valves, the reagents. And as I told someone the other day, it's like having cereal and no milk, right? You can't have a cereal breakfast, if you don't have one of the two ingredients. Well, that's what's going on with testing as well. And so people ask, well, why are we doing it so late? We're doing it so late because we're just getting the actual ingredients together to actually perform this sort of testing. And even with that, Richard, we have a finite amount of tests that we can perform on a daily basis. What we did yesterday, we did over 100 tests over near Creighton Court in the east end of Richmond. It's my hope that we can get up to doing 1,000 in the city at a time, and also providing that to folks who are uninsured and under-resourced. The governor said he wants...
And I want to put a pin in that one because that is huge to me. When I read the stories, what you're hearing from people in these communities, Levar, is this: we can't afford the test, even though we know, and you and I know, that the test is free, right? Like the test is free, it doesn't matter, you should be able to get it. So there's so many barriers sort of nestled in there that I do believe, as we think about getting over this first wave and going into a second wave, a lot of the mid-sized cities like yours and others, and the mayor of Rochester, those type of cities are the cities that will be where the second wave starts, because you guys weren't getting the resources that you need. You're not able to sort of mobilize you have the people and the personnel, but you don't have the testing resources to get into vulnerable populations and say, we're going to test this entire building.
That's
and then
correct.
You're going to lock it all down so we can prevent it.
And what worries me the most, Richard, is that the asymptomatic nature of this virus, right? That you could have the virus, not even know it, not display any symptoms, and we reopen and you go back into the workplace and then boom, you have an explosion right there. Well, we've done a good job here locally, Richard, is that the beds are empty essentially, right? We have not overrun our health system. And that's what this whole exercise has been about. That's what flattening curve has been about. But my fear is we go too quickly into the reopening phases that you can easily overrun. We're a mid-sized city, a mid-sized region. You can easily overrun the healthcare system here.
So Levar, like talking to men of color, if you had a message out there beyond folks living in Richmond, right? We started this interview talking about the fact that a lot of African Americans, including brothers, don't want to get tested because of the sort of side eye that we give the healthcare industry because of the Tuskegee Project and so on. What would you say to a brother out there who has some symptoms or has come in contact with somebody who had symptoms? What is your words to them in this moment?
I would say, hey, I understand your lack of trust. I understand the historical injustices from the medical system, the healthcare system, and what it's done to African Americans, whether it is the Tuskegee experiment or what Henrietta Lacks went through. However, what I can tell you is that this is not one of those moments. This is not one of those moments. This test is just a swab of your nose. It's not an injection. It's not an injection. We do not have a vaccine right now. There is no therapy for this disease. And if you want to save a life, not only save your life, but save someone else's life, the responsible thing to do in this moment is to get a test. I'm begging you to. From one brother to another brother, it is the responsibility is on us. We got to do it. Must do it.
The responsibility is on us. Levar Stoney, Mayor of Richmond, thank you for what you do, my brother. We will definitely continue this conversation because guess what? Cities like Richmond, cities like Rochester, they matter. Your voices are important. And if we are going to stop this disease in its tracks, we're going to have to work with mayors like yourself. Thank you so much for joining us on Talking Together.
Thank you. Take care.
Thank you.